Hello, Hae Seung Lee. I'm Dr. Kaminski. You've reached the telemedicine Skype service.
Hi.
Is this your first telemedicine appointment?
Yes, it is.
I understand that this can feel a little different or uncomfortable talking through the computer, but I just want to let you know how you can see and hear me. I can hear and see you just the same. And everything we talk about is going to be completely confidential, and I want you to feel as comfortable as possible, as if I were a regular doctor talking to you in person, okay?
All right.
So, what seems to be bringing you in today to my services?
Well, I've been feeling a little down, just not like myself.
Well, why is that?
Well, you see, I live in a really rural area, and I now live alone. Nothing really seems to be worthwhile anymore. I've been having a lot of trouble sleeping. I told my friends about how I was feeling, really sad, when we at the bar a few weeks ago, and they suggested me to try this Skype thing out since I live so far away from my doctor's office. I also don't even feel like leaving my house, and I haven't changed out of my pajamas for 3 days.
Oh, well, I want to thank you for taking the time to come and seek help. While feeling sad and feeling down is a normal part of human life, in excess, it can interfere with day-to-day activities. If you don't mind me asking, how are these feelings affecting your life?
Well, like I said, I haven't seen anyone or left the house for 3 days. I also was recently fired from my job due to poor performance.
I'm really sorry to hear that. It sounds like a stressful time for you.
Yeah, it really is.
When would you say these feelings started? Around when?
Well, it was probably when my girlfriend dumped me. She was my whole world. Then she just left me for another man. No matter what I tried to do to keep her, buying her expensive presents, pleading with her, she didn't want to stay with me.
That sounds like a really traumatic event. How long ago was this?
Probably about 6 months ago. Yeah, it was really hurtful and hard. Now I'm past being mad at her for getting with the other guy, and I'm just sad that I lost her.
I'm really sorry you're feeling so poorly. Despite this hard time, do you find that there's anything that makes you feel better?
Not really. I guess seeing a friend is a nice distraction. Work was a reason worth waking up, but now that I've been laid off, nothing really cheers me up.
From what you're telling me, it sounds like you're feeling depressed. Would you agree with that statement?
Yeah, most definitely.
Hey Sung, is it alright if I ask you about some potential problems that may have been bothering you within the past 2 weeks?
Yeah, sure.
Alright, so I'm going to ask you about some general potential issues. Just tell me if these problems have not bothered you at all, have bothered you for several days, have bothered you for more than half the days over the past 2 weeks, or have bothered you nearly every day for the past 2 weeks, okay?
Okay, got it.
Have you had little interest or pleasure in doing things?
Yes.
So would you say that's bothered you for several days, more than half the days, or nearly every day the past 2 weeks?
I would say nearly every day for 2 weeks.
Okay, have you been feeling down, depressed, or hopeless?
Probably for several days over the past 2 weeks.
All right, what about trouble falling or staying asleep or sleeping too much?
Definitely trouble falling asleep almost every day for 2 weeks. I toss and turn. It's never good.
Okay, what about feeling tired or having little energy?
Definitely every day due to the lack of sleep.
All right, have you had a poor appetite or have you been overeating?
No, my diet is normal.
Have you been feeling badly about yourself, such as feeling you are a failure or feeling you let your family down?
Yes, I feel badly that I lost my girlfriend. I'm a failure at being a boyfriend. I've been feeling this way every day.
Are you having trouble concentrating on things?
No, not really. I wouldn't say so.
Have you been moving or speaking so slowly that others have noticed, or being so fidgety or restless, that you've been moving around a lot more than usual?
Nope, I toss and turn at night, but that's about it.
Have you had any thoughts that you would be better off dead or hurting yourself?
No, I haven't thought of those things.
All right. I'm really glad you haven't been hurting yourself or having thoughts of suicide, but I want you to know that if you ever do get these thoughts of hurting yourself, please contact me right away. Don't hesitate. Or if you feel like you'd like to contact a hotline that's toll-free and open 24/7, there's a number, 1-800-273-TALK. So if you ever, for some reason, feel that way, there's always someone to go to. Always go to those places, all right?
Right, good to know.
Okay, so I see that I have some of your information, medical information, sent over to me from your primary provider at home. But would you mind filling in some of the gaps in my record?
Sure, what would you like to know?
Do your parents or immediate family members have any major medical conditions?
My dad has high blood pressure, but that's it.
Any family history of depression, suicide, schizophrenia, or any psychological issues?
I don't think so.
What medications are you currently taking?
Just a multivitamin most days. Maybe some ibuprofen if I get a headache.
That's great. Some medications can have depressive symptoms as side effects, so we can rule out that your depression is not a side effect from a medication. Do you have any known allergies?
I'm allergic to pollen.
How about any drug allergies?
None that I know of.
Okay, well, how frequently do you drink alcohol during, say, a given week?
I've been drinking really heavily, probably every night, most days of the week. When I go out with my friends, I try to black out to forget my memories of my girlfriend.
I thank you for being honest about your alcohol usage and telling me everything. I appreciate that. Do you use any recreational drugs such as marijuana, cocaine, pills, hallucinogens when you go out?
No, I don't mess with that stuff.
Okay. Could you tell me about your exercise habits?
I used to be really into going to the gym and lifting weights, but probably haven't done any exercise in the past 6 months since I've been single. I just haven't been motivated to go.
All right, Hae Seung, based on my assessment today, I would consider you to be diagnosed with moderate depression.
Wow, I knew I was sad and depressed, but I didn't think it was a real condition I could be diagnosed for like a disease. What does that even mean? I thought we're just going to talk about my feelings here.
I just want you to know that you aren't alone. The National Comorbidity Survey found that 16.2% of the population studied had a major history of major depressive disorder in their lifetime, and more than 6% had a depressive episode within the past 6 months. So you're not alone. This is very normal.
Well, I guess that's a bit reassuring to know.
Biologically, when you're depressed, your brain is just acting in a different way. There are many different theories about this complicated issue, but depression is usually thought to be an imbalance of chemicals called neurotransmitters in your brain.
This sounds sort of scary.
I promise you that this is nothing to worry about. There are many options to help you through this rough patch you're experiencing. I just want you to know that scientifically, it isn't your fault that you're feeling this way. It's merely a biological response to things that are going on inside of you. I'm on your team, and I'm here to help you every step of the way. I want your mood to improve and you to feel like your old self again.
I really appreciate that. It's nice to feel like someone cares.
There are some lifestyle changes that you could make to improve symptoms of depression that you're experiencing, such as insomnia. What are your sleep habits like?
Well, like I told you, I go to bed and toss and turn and can't fall asleep. It's maddening.
Do you have any nighttime rituals?
I usually eat dinner, which has been takeout in front of the TV at 10 o'clock. Then I play Call of Duty on my Xbox for 4 hours, drink a few beers, and try to fall asleep by 2.
Okay, there's a few things you can do to improve your quality of sleep. I would recommend trying to eat dinner earlier and refraining from overly spicy, fatty foods that can cause nighttime indigestion.
Big Macs and spicy Thai food are my favorites, but if it means sleep, I guess I could try that.
Also, did you know that drinking beer and alcohol could be making your sleep problems worse?
What? I usually drink to help me fall asleep.
Unfortunately, while it can make you sleepy at first, it disrupts the REM sleep, the rapid eye movement stage of sleep, which is the really deep sleep you need to feel rested. While I'm also very worried about how much alcohol you're drinking, would you be willing to cut back?
Yeah, it's really getting out of hand, and I think I'm going to just stop cold turkey. This whole depression diagnosis has been a wake-up call. I'm willing to try anything to get out of this funk. Although giving up beer won't be easy. To be honest, I might have a hard time with this one.
I'm really impressed with your attitude, Hae Seung. There are resources and support groups for those who are choosing to live an alcohol-free lifestyle. I'll send your doctor the information to get you in contact with these groups. It sounds like your social life revolves around going out and partying and drinking lots. Maybe this is a trigger for you that you could avoid?
It is definitely a trigger. I've been avoiding the facts of it. I would like to get in contact with an alcohol-free group. I think maybe I can make new friends here, and it might cheer me up to be around people.
Great. Also, to help you sleep, I would recommend limiting screen time before bed. The blue tinted light from your TV emits while you play Xbox, and it's making it hard for your brain to shut down, since it's processing the light from the TV as if it's like the daytime light coming in from outside. Bless you.
Yeah, that's really crazy. Maybe I'll read my Game Informer magazines before bed instead.
That's a really great solution, Hae Seung. I think you could benefit from some exercise too. Exercise helps your brain to feel good. I know you said that you used to go to the gym and lift weights, but would you be willing to try that again?
I don't know. I've been out of it for so long.
I understand. I just really want to encourage you to exercise in any way possible. Even if it just means parking your car away further and walking into the grocery store. Even just going on walks can help. This will improve your mood, and a better mood will improve and lead to better social interactions. I also want you to call up your family and friends. It's really important to create a support group of people who you can turn to when you're feeling really down.
Yeah, I'm very close with my family, but really haven't been talking to them lately. Maybe I'll visit with my brother.
Good idea. I want you to put all these lifestyle modifications into place. It won't be easy, but I would also like to put you in contact with a licensed therapist to talk about your depression. Since your depression is moderate, I would like you to try these lifestyle modifications first before we progress onto a pharmacologic option like an antidepressant pill.
Well, I would like to know more about that treatment option just for future reference.
Sure. For a patient with your symptoms, I would recommend an antidepressant like acetylopram, also known by the brand name Lexapro. I would start you on a 10 milligram pill taken once daily at the same time every day. It may be taken with or without food.
Just a pill and all my horrible depression is gone?
Lexapro may take several weeks, maybe 4 weeks, 6 weeks, it depends on the person, to notice effects. As with any drug, there's also some side effects that come with taking it.
What sort of side effects?
Common side effects are changes in appetite, headache, dizziness. Serious side effects that may be experienced are allergic reaction like rash, swelling of the face and neck, suicidal thoughts, or seizures. These are all serious side effects that need to be reported to the doctor right away. It's also commitment. You need to take this drug every day and not abruptly stop taking the medication. Also, if you are taking it and all of a sudden you just feel like it isn't right for you, we would need to work together to taper down the dose and wean you off of it and then switch you to another antidepressant medication. Also, alcohol really interacts with this medication, causing severe cognitive impairment by potentiating the effect of alcohol. So say you were on this medication and you went out and you just had one measly drink. This can make you feel really inebriated and really drunk, and if you were to drive, that would be a bad situation.
Yeah, it sounds like I should try to change my habits first before trying any medications.
I agree. Lifestyle change should come first, but these medications are still an option for you. I'm really proud of you for choosing telemedicine, even if it was so you just didn't have to get out of your pajamas.
Telemedicine was actually a great choice. It saved me a gas money from driving all the way to my doctor's. I also live 2 hours away from the doctor's, so 4 hours round trip is a lot of time spent driving. By choosing telemedicine, I saved some time and money, which was great. Maybe I'll put that gas money towards a gym membership. I also felt more comfortable talking to you from my home since the doctor's office gives me so much anxiety. Everything is so wide and clinical.
Okay, well, that's good to hear. Just to be sure I'm not forgetting anything, can you tell me what you're going to do to try to, improve your depression?
Sure, I need to make these changes for myself. I need to try to beat depression. I'm going to do this through lifestyle management first. If these things don't work, I will come back to you for the Lexapro antidepressant medication.
Sure, but tell me specifically about the lifestyle changes you're going to make to improve your depression.
I need to get my sleeping back on track. I'm not going to eat bad, heartburn-inducing foods late at night. I'm going to limit my screen time before bed. Maybe read instead. I'm going to try to cut back a little bit at a time with alcohol, but ultimately, I would like to sign up for an alcohol treatment program to help me cut back with my binging and meet people who want to live alcohol-free lives. I'm going to try to get exercise, even if that just means walking at first, maybe getting back into the gym once I feel up for it. I'm going to visit my family and friends more often and seek their support, especially when I'm feeling low. Also, I'm ready to start counseling or therapy.
Excellent, Hae Seung. I would like to see you for a follow-up visit in a month, just to check in with you and talk about your progress. Thank you for your time and choosing telemedicine services. Take care. Be well.
Thanks, bye.
Bye.